Good evening, good afternoon, good morning to some. This particular video, I wanted to speak with you about therapy in the schools. Therapy is a tricky area. Honestly, in my professional opinion, I really don't think that therapy can be done in the school. There has to be some reconciliation between HIPAA and FERPA because above else, and you have to always think ethically, in what way are we protecting our client with confidentiality? That's very important. Who has access to those records? And if I work for the school system, although I may be a mental health professional, are those records protected? Another critical piece to consider is therapy is different than counseling. Counseling is more surface. I can counsel about their behavior in the classroom, how to maybe do things better academically, vocational. However, therapy is much more intrusive. It gets into a lot of the feelings, and possibly doing therapy in the school, being that intrusive, it may open up a lot of wounds. How is that person doing when they go back to class? Because you're unpacking stuff about them that they may not have discussed with anyone else. And then you're asking them to pack it back up and compartmentalize to go back and study where they may not be able to focus. Developmentally, they may not be at the stage where they can do that because everything may not be abstract, or it just may be too painful where they may have to go home afterwards and just have some time to process it. So I think possibly counseling, or therapy that's not too intrusive. There's things there about art therapy, which you usually may do with little children, but we also just have to be prepared for the unintended consequences. Yes, it is a good place because you can see children. They may not necessarily have to miss too much instruction time or as much instruction time because they're in the building. It's just a few minutes for them to walk to the office. Personally, again, as it goes back to confidentiality, my concern would be once other students know who you are, that's the social worker's office or that's the child study team. Do they know exactly, can they pinpoint or something is going on with that student? Because all students may not go to that office. How safe it is emotionally. Is it a safe zone for that student on both sides? So you have to think about it is a lot of stigma attached to seeking services to address mental health or behavioral issues, although we do not want to label children. But this is a weight, that has to be balanced when you think about it. So for me, we have to ultimately always think about the safety of the client. You have to always think about confidentiality. Do you want to be in a compromising situation where the principal may come and ask you, what did you discuss with that student? That student's mental health records are protected under HIPAA. But in what way can you do that, in a school environment and also where you have FERPA? So, you have to really, really just think about that. And is it something that really can be reconciled? Or do you think it may be best for a contracted provider to do, where they may not have to deal with the politics as you may have to deal with being an employee of the district, because your responsibility is to the profession as a social worker. But do you want to put yourself in a situation where you're being insubordinate in regards to doing therapy? Remember, counseling is much more superficial. Students may kind of talk to you about their day or how things are going on in the classroom, where, that may have been the reason why they were referred to you. We're all members of that team. And what I mean by team, it could be the academic side, the teacher, the other students, the principal may be aware of it, so it's not like you're, in a sense, violating confidentiality. But it just may be an uncomfortable situation when you're doing therapy and they have to return to the class. Think about you. Can you unpack something so intimate about yourself and then pack it back up and just go back to work? Can you really focus on the task at hand? Or do you, maybe wander? Your thoughts may wander, which may lead to another problem, an unintended consequence in an academic setting. So I just want to give you some thought when you think about doing therapy. I don't want to discourage anyone, but you have to consider all of these factors that it entails. So that's it for now.